The coronavirus vaccine made by Moderna faces an important test today, a review by a panel of independent experts. When it's approved, the Moderna vaccine will be the second available in the U.S. The approval could come as early as tomorrow. Now, the addition of Moderna's vaccine comes as Pfizer's shots face some first hiccups. And Moderna's vaccine has a couple of distinct advantages over Pfizer's. So, of course, we brought in Quick Takes Madison Mills to give us some more. Maddie?
Thank you so much, Scarlett. I want to go to the CEO of the National Association of County and City Health Officials, Lori Freeman. Lori, thank you so much for joining us today. I want to start off by chatting with you about how exactly local health officials are deciding who gets the vaccine first. We know that municipalities are getting shipments of these shots, right? But how do they decide who gets them first?
Well, first of all, the goal is, of course, for everybody to be able to easily get a COVID-19 vaccination as soon as large enough quantities of vaccine are available everywhere. As vaccine supplies increase but remain limited, we're going to keep relying for now on the Advisory Committee on Immunization Practices, ACIP, to be expanding the groups recommended for vaccine. As we begin to roll out other phases, we'll begin to see the prioritization become more of a focus, and there will likely be a need for ACIP to further clarify some of the definitions to help with the rollout. And we don't know when or if they'll be further defined, but we're waiting to see that. The 64 jurisdictions across the country that are mostly states and territories and directly funded cities have been allocated vaccine, and they are the distribution points. And those facilities and providers that pre-registered for allocations through systems set up by the CDC will receive the priority shipments, but we know that isn't enough yet.
Lori, you mentioned ACIP and their recommendations that we start with healthcare workers and people who live in long-term healthcare facilities, but I'm more curious about on the individual level, how are hospitals and health providers deciding who that first person is going to be? And are there any specific systems, there we go, you've seen put in place that have struck your interest as to how providers can make those decisions about who should be the first person to get the shots?
They're probably going to look first at who is in most contact with people that are vulnerable to the disease. So those people that are really those frontline healthcare workers who are in regular contact with individuals, and then those who are in regular contact with individuals that are most at risk. And likely that prioritization will get them started, and the vaccine will really get ramped up quickly here. And with Moderna possibly coming on the scene, the supplies are going to increase rapidly, so we won't be in this mode of having to make decisions within decisions for long. But in the initial stage, it will be based on how we can protect the most people.
And I'm wondering if it's been difficult for local health officials to make these critical decisions without more clarity from the federal level. Can you talk to me about the difficulty of that?
Well, it has been challenging because the planning of this has been rapid, and the variability of how the plans incorporated communities and local health departments is different across the country. And so we have situations where they might be more state-based decisions. There might be other areas where state and locals are working together, and others where there are locally driven decisions. And so we have to, it might sound arbitrary, but we saw this happen with H1N1 as well, where it really depends on the number of doses reaching communities, the number of vaccinators, the number of people getting vaccinated, sort of the burn rates of the vaccination. And these are all sort of critical variables in the equation here. But the inclusion of local health departments is important regardless, because they're on the ground, they know their communities, they know their vulnerable spots in the communities, and they know the messaging needed there.
And moving beyond vaccines, public health officials have also had an uphill battle getting people at the local level to follow public health guidelines like wearing masks, right, due to the politicization of the pandemic. I'm wondering if you can tell me about the challenges that local health officials have faced in dealing with harassment and pushback from locals about these public health measures.
It's been really a challenging time for our public health agencies that working in counties and cities across the country. It's really impacted the morale. It's been an affront to their public health training. It's taken its toll on public health leaders through departures that we're hearing across the country. We believe there are now well over 100 or 150 public health officials that have left their positions throughout the pandemic. And all of this is having a large impact on the workforce at the local level. We worry that this loss of leadership will continue as we move forward into the final stages of this vaccine distribution. And really the only way around it is to rebuild the trust in our public health system in our local public health authority. On the ground, they really are just trying to keep communities protected and get us back to a place where we can return to our normal lives.
Lori, thank you so much for joining us today. Certainly sobering data to keep in mind.
The biggest stories the moment they happen from around the globe. Subscribe to Bloomberg Quick Take now for insight in an instant.